If you are facing IVF failures or implantation failures or even recurrent miscarriages, then you might have heard about the ERA or Endometrial Receptivity Analysis test. So hello, I'm Dr. Jwal Banker, and today we'll be discussing all about endometrial receptivity and this ERA test. Let us start by understanding how or when the embryo is implanted. That is called the window of implantation. The window of implantation is a brief period in the menstrual cycle during which the endometrium is receptive to the implantation of the embryo. The endometrium needs not only to be thick and vascular, but it also needs to be receptive to have a good pregnancy. This window of implantation typically occurs around 7 to 10 days after ovulation, and if this window is deranged, then it can cause implantation failures, which is a common cause of infertility. The ERA test helps determine the precise duration of this window of implantation by analyzing the gene expression in the endometrium. If there is any derangement, it can guide your embryo transfer. By ensuring that the embryo is transferred during your optimized or personalized window of implantation, the chances of a successful implantation and pregnancy can be increased. So what is the ERA test? The ERA test stands for Endometrial Receptivity Analysis. It is a diagnostic test that evaluates the acceptance or the receptivity of the endometrium, that is the inner lining of the uterus, to the oncoming embryo. It tells us whether the uterus is ready to accept the embryo or not. This test measures the expression of certain genes which have been found to be responsible for implantation in the endometrium, and based on this expression, it gives you a precise timing of an embryo transfer. So who needs this ERA test? ERA test is recommended for couples who face multiple implantation failures or recurrent early abortions despite undergoing multiple IVF cycles. In these women, around 20 to 40% of these women have a deranged window of implantation, and the ERA test can be helpful. So how is the ERA test done? For the ERA test, the endometrium is prepared using the standard frozen embryo transfer protocol used in the clinic. So typically from the second or the third day of the period, estrogen is started, and after 10 or 12 or 14 days, a checkup is done to see the endometrial thickness, and on the same day a serum progesterone level is measured. If these parameters are normal, then progesterone medicines are added. Both these medicines are continued for a period of around 5 days, which is the same as we would do for a blastocyst transfer. But instead of transferring the embryo on that day, a small tissue from the endometrium is removed with the help of a small tube or a pipette, and this tissue is sent for testing. RNA is extracted from this tissue, and genes are analyzed using next generation sequencing, which is a very accurate method of testing. This is a practically painless procedure, and anesthesia is generally not needed. The patient can go home soon after the procedure is done. So what are the possible results of the ERA test? The results of the ERA test can show one of these two findings, either a receptive report or a non-receptive report. A receptive report means that the window of implantation lies on the same day on which the biopsy was taken, so typically after 5 days of progesterone. A non-receptive report can either be pre-receptive or post-receptive. If you have a pre-receptive report, it means that under the same conditions, your uterus was pre-receptive. That means it needs a few more days of progesterone to be receptive. If you have a post-receptive report, it means that you need fewer days of progesterone to achieve the same gene expression level in the endometrium as a receptive endometrium would have. These changes can occur by 12, 24 or even 48 hours. Therefore, a blastocyst embryo, which is typically transferred after 5 days of progesterone, might need 4.5 days, 4 days, or even 6 or 6.5 or 7 days of progesterone before we do a transfer to have a good chance of a pregnancy. So what are the pros and cons of this ERA test? Studies have shown that by transferring the embryo in your personalized window of implantation, it can reduce the chances of implantation failures and miscarriages. It can also reduce your time to pregnancy, which eventually reduces the financial and the emotional burden of multiple IVF cycles. But on the contrary, there are certain studies which have shown that this test is not useful and not very accurate, and it also can be expensive. It is also important to note that out of all women who face implantation failures, only about 20 to 40% of those will have some derangement in the window of implantation. So we don't have an answer for all implantation failures. Hence, more research is being done every single day, and you should only get it done if your doctor advises you to, and get it done from an accredited center. So in conclusion, this ERA test is a useful and an important test for those women who are facing recurrent IVF for implantation failures, and also early miscarriages. This helps you find out your personalized window of implantation during which a good grade blastocyst embryo can be transferred and give you a healthy pregnancy. It also reduces the burden of multiple failed IVF cycles. However, it is important to weigh the pros and cons and only get it done if your doctor advises you to. If you have any doubts, let me know in the comments, and thank you for watching.